All right, Jim, let's get to the first question. How is Maui Health working with governmental and other agencies to prepare for the potential surge of COVID-19 patients?
Yeah, well, that's a great question. And all of our facilities and the health system, Maui Health, we've been coordinating our efforts with the Healthcare Association of Hawaii. That's the organization that represents hospitals and nursing homes throughout the state. We've been coordinating with Kaiser Permanente National Office back in Oakland, our peers up in Honolulu, the Kaiser Permanente Hawaii region, the State Department of Health, the Hawaii Emergency Management Agency, Hawaii Disaster Medical Assistance Team, as well as other state and county governmental agencies and committees and emergency operations centers, etc. And so all of these coordinated efforts really help us here at Maui Health prepare for a surge of COVID patients, and more importantly, in securing personal protection equipment. You sometimes hear that called PPE, and ventilators and other medical supplies. So we spend a lot of time coordinating with related agencies and peers throughout the state just to make sure that there aren't any gaps in our planning as we go forward.
I'm going to go and give you this question that just came in from our text from one of our listeners. She says that she's asking for a friend who believes he has the virus. He's been quarantining himself. He has symptoms. He's not sure if he has it, but he doesn't have a healthcare provider.
Yeah, and that's not uncommon here on the island. And so what I would suggest, if that individual feels that they do have symptomology and they don't have a provider a primary care provider, etc., just go to the emergency room. But before you go, I would call.
Okay.
Because the emergency department can give some advice and counsel on whether they should come into the hospital or if there's somewhere else that they should go. So that's what I would recommend right now.
Awesome. Thank you for that answer. Okay, what specifically is Maui Health doing in coordinating with Maui County and local agencies?
Yeah, again, a lot of activity happening at the county level. So we are really fortunate to work with the leadership of Mayor Victorino and his staff. And right now there's a couple of things happening. We're awaiting the report from the U.S. Army Corps of Engineers on their FEMA, that's the Federal Emergency Management Association, sponsored survey on Maui that occurred about 10 days ago. And that's specific to what we call alternative care mobilization. So if Maui Memorial in particular becomes overwhelmed with patients, COVID-19 related patients, we also need to begin to look at alternative care sites off the hospital campus. We don't think we're going to that we'll get to that point, but in the event we do, we really need some assistance, and that's where the U.S. Army Corps of Engineers comes in. And from what we're told is their report should be in sometime this week coming into the county. So that's one area where we're working with the county. We're also coordinating with the mayor's alternative site committee to coordinate between all of the major providers on within the county to ensure that we have appropriate locations of care. And so that includes Hale Makua is at the table. Of course, we are HSMA, Kaiser Permanente, et cetera. So a lot of collaboration there. And then, of course, we're working with the county's Emergency Operations Center and the Maui Emergency Management Agency as well. And, you know, one of the things we've really been pleased with is we're very heartened by the outpouring of support from local businesses, especially MEDB's efforts to produce some bridge ventilators in Maui. Bridge ventilators are devices that can be used in the event that we're stressed with the available ventilators that we have at the hospital, meaning we don't have enough. And these devices can serve as a temporary ventilator until a full-service ventilator is available. And that's being produced and manufactured here on Maui.
Nice.
That's pretty awesome. And the mayor at the county actually sponsored this activity by making a $100,000 investment of available. And so we're pretty excited about that. And then, I think also through the support of our hospital foundation, we're able to support local restaurants and providing meals to our caregivers at the hospitals, and also to receive donations of medical supplies from the community, which we've again seen an outpouring of support for. So we're really blessed here on the island of Maui and in Maui County. The ohana is just very strong, and we couldn't be happier with that.
You are very right about that. And in our final question, besides we, the community, abiding by the guidelines, the social distancing, how else can the community help?
Yeah, well, there are a lot of people stepping up and asking really how they can help. And what I would suggest is for our listeners to go to our website, which is mauihealth.org, and then /COVID-19. And if you go there, there's all kinds of information on how to take care of yourself and your ohana, and also how you can maybe help the system with donations or volunteer activities, etc. And so that's really the best place to go to get that information.
Awesome. Hey, thank you, Jim, for all of your answers this morning. And I know we'll be talking again in the near future. Any last words before we're done here, friend?
I don't think so. Again, just practice social distancing, wash your hands, and pay attention to the public health experts. That's how we're going to get through this.